Hello and welcome to this series of learning and study skills in medical education for undergraduate medical education. My name is Mohamed Hassan Taha, Director of Medical Education Center at the University of Sharjah, Assistant Professor of Medical Education. In this series of videos, I'm going to show you important skills related to studying and learning. This is the fourth video in this series, and in this video, we will be explaining small group and team learning. In this video, we'll define small group learning in medical education, explain the advantage of small group learning, discuss the principles of group dynamics according to Tuckman model, and identify tutors and students' role in small group learning. We'll analyze and provide some suggestions related to common problems in groups and propose strategies to overcome them. Finally, we will reflect on your learning, on group learning and experience. Why this session is important for you? You will learn medicine, health science in the groups. You will practice in teams. And it is very important, your habit now shape your future for clinical performance. I'd like you to reflect. Think about small groups that you have been part of. This could be educational or social. Think about how this group developed. What was it like when you first met? What difficulty did you encounter? And also think about what made the group work well or bad. Please stop the video for a minute and try to reflect. Because we present this slide at the beginning to help you to think about the small group learning. What is small group learning? It is instructional strategies. And these instructional strategies way students learn in smaller, collective, collaborative groups to achieve shared learning goals, often receiving personalized support from the teacher. So this approach actually shows that it fosters active participation, allow for more tailored instructions, and help students develop critical social and emotional skills by engaging with different viewpoints and working together. Why it is important in medical education? Research shows that, or report that, regardless of the subject matter, students working in a small group tend to learn more of what is taught and retain it longer than the same content is presented in other instructional format. And studies show that it helps to enhance retention and understanding, enhance clinical reasonings and problem solving, improve communication and teamwork. This is very important. Strengths of small group learning. And also show many advantages, such as active engagement with material, opportunities to explain and teach each other, build lifelong learning habits, and encourage listening and empathy with respect. I'd like you to reflect, which of these advantages do you value most and why? To understand small group learning, very important, we cannot understand it without understanding very well the group dynamics for you as students and for us as educators. Let's go into group dynamics. Group dynamic refers to the patterns of interaction, behaviors, and relationships that develop when people work together in a group. Understanding group dynamics very important because it helps us as a tutor and it helps you as students to create more productive, respectful, and supportive environment that maximize the learning process. So a highly achieving group will be resulted from these elements, including being productive, respectful, and with the supportive environment, and handling the challenge during the group dynamics. So the group dynamics including how members communicate with each other, or communication style, and how roles and responsibilities are shared, how decisions are made and how conflicts are resolved, how trust norms and cohesions we build, and how the group evolve over the time. Tuckman describes 5 stakes in the group dynamics and the group stakes, sorry, and these group stakes describe this. We start for every group start with forming, then storming, then norming, performing, and adjourning. You can see here the low performance in the storming and the highest performance in the right side of this diagram. Regarding team effectiveness, with storming, less team effectiveness. So this is very important. When the group meet each other, they start orientation and they get acquainted. After a period of time, the group or the team is the most cohesive part of the group, and there is a difference between team and groups. We want you to work in a team, as a team, not as a group only. In storming, team experience different behavior because there will be some sort of tension, conflicts, competition, position. Everyone within the team try to take maybe leadership position or to show knowledge or something like that. The team, they will realize that if we continue in this way, we will not achieve anything. Then after that, storming take place. So they try to resolve the conflicts and they try to build a mutual norm, unity, trust, and they start to clarify the roles and the responsibility. Following this, performing will take place. And in performing, a well-established team will be built based on team corporations, team cohesions, and then will result in high-performing team. And at the end, in the adjourning phase, a team become dissolved. We need to reorganize, need to celebrate success, and so on. So these are 6 important mistakes. Yeah. So I want you to reflect. Why do you think that the most of your study group get stuck? And what helps move forward? This is very important thing that need to be considered. And as a leader in a small group or team, you have to learn very well about this stage of group formation or team formation. What makes some groups successful, and on the other hand, what makes them some group non-successful? In order to answer this question, we need to know the ingredient of effective small group learning. Very important, the task should be clear and the timing. The size should be optimum. Not too large size so that this will create problem, and not too small size, this will affect the discussion. Clear individual accountability and collective responsibility should be declared and should be there. And it's very important to pay attention to interpersonal skills. We have difficult members in the group, and we encounter them in our day-to-day life as students in the group. Some of the group members may be talkative, some of them quiet member, some of them deal as expert, know it all, some of them complainers, clowns, arguers, latecomers or side talkers. How to deal with them? The next slide will provide you with some suggestions. You can use them or you can use others, depend on the context. For the talkers, you can assign them with a specific role. For the quieter, you can invite them gently and avoid pressure. For the people who behave, they are expert, know it all, you can summarize their thoughts, then redirect the discussion to the others. You may encounter some complainers. You have to acknowledge their enthusiasm, then move to others. You may have some people like clowns. You have to request them from serious input. Arguers, avoid any debate with them. Open the discussion to the group. Latecomers, don't reward lateness by giving them, by going back and explain to them what you have discussed early before they're coming. And for the side talkers, it's very important to redirect the group discussion. It's very important to know the difference between group and team. And we want you to be working basically on the right side, the team. In the teams, the task is coordinated to achieve a shared aim. The members rely on each other's resource to achieve the common outcome. Their mutual commitment to goal to each other. There is synergy in the performance, and the team help one others to unlock potential and to push beyond limitation. And the next slide show clearly the difference between team and group. And this is the right slide. The right side of the slide is a team in which people working toward common goal who coordinate their work amongst themselves. While in the group, people working toward a common goal, toward a goal whose work is coordinated by someone else. So in the group, there is the leader and people work, but in the team, although there is the leader, but they work, the common goal coordinate their work. And we need to know what makes team functional and what make teams dysfunctional. So this is slide from the book, The Five Dysfunctional Team, written by Patrick. So the dysfunctional team, in the dysfunctional team, there is absent, and this sequential, in the dysfunctional team, you'll find absence of trust, fear of conflicts, lack of commitment, avoidance of accountability, and there is inattention to result. On the other hand, on the left side, you'll see in high-performing team, there is a trust. And they are dealing with conflict. Conflict is good because we can learn from the conflict, but if we deal with this conflict professionally and try to overcome them rather than escape from them or to overcome them or to avoid them, sorry. There is a commitment, there is accountability, and there is attention to this result. Let us see this framework. The next slide will describe this framework in a clear way. As you can see here, for the lack of trust in effective team, there is a safe environment to speak. Regarding fear of conflict, effective team confront problems and try to solve them quickly. Effective team, regarding lack of commitment, they buy in alignment with the common objective, and there is a clear direction to priorities and high engagement with the team member. In order to overcome any avoidance of accountability, the high-performing team, they deal with the poor performance in a good way. They manage them, they train them, and so that they become accountable. And the same standard apply to everyone. To manage inattention to paying result, in high effective team, there are outstanding and recurring team results. Very important. And they are highly motivated and engaged team. These very important, and this slide shows us how effective team overcome this 5 dysfunctional team. Why we are studying this small group learning and team learning? Because it's very relevant to our practice. Healthcare requires collaboration across discipline. Patients depend on teams, not only physicians, nurse, and so all teams provide the service together, not the individual. And small group learning is a safe training ground for future work. I'd like you to ask yourself this question. What habit you practice now in a small group will carry into clinical practice? This is very important. So a good habits will help us to be effective team member. Bad habits will lead to ineffective team and dysfunctional team. So it's very important to revise our habits while working in team or in group. And it's very important also to identify and to know our roles. The next slide describes the role. We should know the role of the different member in a small group. The care of the group is the one who lead the group. Encourage them to participate, maintain the group dynamic, support the environment, keep the time, and so on. Scribe is the one who takes the note, support the leader, engage in the discussion, and help to organize thoughts, and so on. Group members, they should show respect to each other, participate in the discussion, listen, and ask questions, establish safe environment, and so on. Research all outcomes or objective. And the tutor is the one who support the management of the group and pay attention to the knowledge transfer, facilitation, as well as also paying attention, very important, to the group dynamics. So I come to the end of this video. It is the fourth videos of the series of studying and learning skills for undergraduate medical education. Now, we would like to welcome you to the fifth and sixth videos, which will be about study skills for undergraduate medical and health science education. And see you there, inshallah.